And we are live with Stephanie Wolf, the CEO of Novus.
Hi, everybody. Stephanie, nice to meet you.
I am one of the other hosts, Austin James Wolf. Nice to see you all again. I guess I just want to start off with just add a little bit of credibility. She's also my mother, so I don't know if I should call her Stephanie or Mom. Boss.
We have a lot of fun here.
Mm-hmm. So, Mom, what are some of your credentials?
So I am a physician assistant, and I've been working in family practice for the last 18 years before I started Novus.
What is family practice?
Family practice is everything from, I would see as young as a 5-year-old, and my oldest patients were in the hundreds club.
Mm-hmm.
Yeah.
Ooh.
And I would do anything from pap smears to physicals, to managing diabetes, blood pressure, cholesterol, COPD, congestive heart failure, you name it, I managed. Everything, yeah.
Cool, sweet. All right, I guess I'll jump right in. What made you get into healthcare in the first place?
You know, I get asked that question a lot, and I don't really have this big answer for anyone. All I know is I wanted to be in healthcare since I was a little girl. So I've always wanted to help people, and that's just my calling. So that's kind of where this all started.
Yeah. And what was that path for you? I don't really know the path. You go to college and then you go to med school. Is that sort of how it works?
So you get your undergraduate degree.
Mm-hmm.
My undergraduate degree was in biology, life sciences, and then you apply to PA school. PA school is usually in the medical school facility. So the place that I went to was called Midwestern University, and they had a DO program, not an MD program.
Mm-hmm.
Same kind of idea as like a PA versus an NP.
Yeah.
They still do the same thing. But this DO program also had a PA program. And believe it or not,
PA stands for?
Physician assistant. Believe it or not, several of my classes were actually with the med students. Like they would combine our classes together. So it was a year of didactics, and then it was a year of rotations.
What's didactics?
That's where you're in class, and it was 10 weeks on, 2 weeks off, Monday through Friday from 8 to 5.
Cool.
So there was no downtime, it was full time.
Gotcha.
Once I got into rotations, mine lasted a little bit longer because I was a little bit delayed. I had Ashley in the middle of it all.
My younger sister.
So it took me 3 years instead of 2 years to finish, but that's okay. Once I got out, I went into plastic surgery, dermatology, and I did a lot of pre and post-op care, lasers, Botox, collagen, that kind of stuff.
Yeah.
And what I realized as I was doing this is, yes, I'm enjoying it, but I'm not helping people the way that I wanted to help people.
How so?
You know, I wanted to help them get better.
Yeah.
And I felt like when they came in for, Botox or lasers, they were better. They just wanted to look better. So it wasn't my idea of what medicine was, right? So that's when I decided to go into family practice. And because I had taken this time gap in between graduating school and working in the plastic surgery's office, I decided that the best way for me to learn about family practice and everything I needed to know was to work with low-income patients who were on the welfare system.
Yeah.
And I saw the worst of the worst. We saw what we called zebras in med school.
What are zebras?
Zebras are diseases and illnesses that you'll never see again.
Oh my God.
So I learned so much in those 5 years that I worked for this clinic that it was very high-paced, very high stress. We saw 50 patients a day, and they were all sick and dying. From there, that's kind of, when we moved here to California, and I started working at the family practice in Glendale. And something that I realized as I was kind of, shifting this focus is that we weren't really healing patients. We were just fixing them.
Mm.
And
Fixing versus healing.
yes.
What's the difference?
Fixing is like putting a Band-Aid on it,
Yeah.
rather than, going through and doing surgery, or, putting sutures on it,
Yeah.
making sure that it's healing appropriately.
Yeah.
So I actually worked for this physician, and I won't say who it was, but something that he said to me was, we are not in the business to heal people, we are in the business to fix people. If you heal them, they won't come back. And
Can you say that one more time for the camera? Listen, guys, listen to this.
So I had a physician tell me, we are not in the business to heal people. We're in the business to fix people. If you heal them, then they won't come back. And if they don't come back, then we don't have a job. And
This was your MD
This was my MD that I worked
working
for.
in a hospital.
No, this was in Arizona.
Okay, Arizona. Okay.
Just to clarify.
Okay.
And it was at that point in time where I took a step back, and I was just shocked, because that's not why I was in medicine at all. I was there to heal people.
Yeah.
I wasn't there to fix people.
Yeah.
And that mentality, I can't imagine knowing that, let's say I'm sending you in, or I'm sending Ashley in,
Yeah.
or I'm sending Dad in. Like, to know that provider, here I am bringing my family members to these providers,
Yeah.
hoping that they're going to heal them and help them. And instead, in their minds, they're saying, I'm just going to put a Band-Aid on them.
Yeah.
And I didn't want to be that. I wanted to be the provider where patients would bring their families to me and trust in me and give me full confidence and know that I was going to treat them exactly the way I'd want to treat my family.
Yeah.
So,
And how are they treating these people? Because I'm sure they cared. Like, what was the difference? How come? What did they not do? I guess my question is, you wouldn't want to bring your family to this environment.
Right.
What exactly were they doing? But mindset aside, what were they actually doing that you didn't agree with?
Well, first of all, I never felt like these patients are being listened to.
Okay.
That's my number one complaint. These patients would come in, and I remember sitting down with them, and that was always the first thing that they would say to me is, for once, I feel like I'm listened to.
Yeah.
For once, I feel like you actually care about what I'm saying. And they're right. We're so busy in family practice, and just the way that medicine is changing, and the way that the insurance companies are managing doctors and PAs and NPs, we're under a time constraint. We have to see patients, every 10, 15 minutes. We don't have time to sit down and listen to their complaints. And that's unfortunate, because these people, they're relying on our education to help them find a solution.
Yeah.
And if we don't have time for them, then how are you going to solve the problem?
Right.
Who's going to help them? And so I couldn't do it anymore. And the other thing I noticed is that there's always a medication for more medication. So you're on a medication, and then you get a side effect. Here's another medication for the side effect. I don't understand that concept.
Yeah.
I don't agree with it
Right.
whatsoever. So in my mind, it was like, these patients were now taking 5, 10, 15 different pills. They don't even know why they're taking them. They don't know what they do.
Yeah.
And they're getting sicker.
Did you see this personally at your job?
Yes. It was awful.
Were you ever forced to write prescriptions for people for their side effects?
I wasn't forced, but it was an understanding that if you don't want to get sued, then this is what you have to do. There are guidelines that you're supposed to follow.
Yeah.
And
wow.
I couldn't do it.
Yeah.
I didn't believe in it. I just couldn't do it. And so I didn't. And I decided to take a step back and say, how can I help these patients get better? How do I help them get off their medications?
Yeah.
I want to be that provider that helps them.
Do you remember the specific period in your life where it all clicked for you when you said, okay, I'm going to take a step back now? Was it just like you saw the last patient and you're like, oh, he's on so many things? Like, what was the moment that made you decide, like, okay, I've had enough. Enough is enough.
Well, there's two instances,
Mm-hmm.
and one of them actually has to do with you.
Oh, I didn't know this. Guys, this is live. I didn't know this was happening, so stay tuned.
So I remember taking you to the doctor,
Yeah.
and they had you on medication,
Mm-hmm.
and you started getting a side effect from it.
Yeah.
And so I brought you back in. I said, hey, this is what's going on. And they go, oh, yes, this is a side effect. Here's another pill for that. And I was like, well, I'm confused.
Yeah.
Why don't we just either take him off the medication or maybe we lower the dose so that he doesn't have the side effect?
Mm-hmm.
And that didn't make any sense to them. They didn't understand
Like
what
it
I was
didn't
talking
click.
about.
They're like,
It didn't
what?
click. Yeah. And so, that was one of the instances where I was like, oh, I get it now. It's all about just writing another pill,
Yeah.
right? The other instance, I would say, is, I'm seeing this patient, and she comes in with a typed up sheet. And when I say a sheet, I mean like an what is it, 8.5 by 11
Yeah.
okay, paper that she had typed up of all the medication she was taking,
Oh.
the dosage, when, like she had X
God.
marks on when she takes it,
Yeah.
and the whole thing lined the entire paper. And she didn't feel any better
Oh
at
my
all.
God.
Like she was, sleepy, she had no appetite, she had rashes everywhere, she had joint pain.
Yeah.
For everything that she was taking, she was sick.
Yeah.
And I said to her, how do you feel about starting to get you off some of these medications? How married are you to these medications?
Yeah.
And that's one big question that I'll ask patients when they come and they sit down with me.
Yeah.
I'll ask them to list out their medications, how long they've been on them, why they're on them. And then my question always is, how married are you to this medication? Because I want to know.
Yeah.
Because what I find is that you have some patients who feel like they can't get off the medication, or what's going to happen.
Yeah.
And I want them to understand that that's why I'm here. I'm here to help you.
Yeah.
I want to help you get better. I don't want you to keep having to take more medication upon more medication.
Yeah.
So that's what I did with her. We started with just one thing at a time. Eliminating. Let's eliminate this. Let's eliminate that. And in that time, she actually started getting better.
Really?
Yes.
How long until she saw an improvement?
I mean, the first month, she started sleeping.
You're kidding.
No.
Wow.
Yeah. It was incredible. And here she had gone for years taking these medications.
Yeah.
Right? And not sleeping. So it's just little tweaks of figuring out what is happening inside your body.
Yeah.
And you really think about it, your body is a machine. It's like a computer system,
Mm-hmm.
right? So if we can reboot the computer system and actually get the computer talking to each other again, get all these signals to talk and communicate rather than all tangled up, they'll actually do what they're supposed to. Your body is extremely amazing, and it's capable of repairing anything.
Yeah.
If you give it the right environment. And that's my thought process is, how do we give it the right environment? How do we get these cells signaling response to happen so that your body actually starts to repair itself?
Right.
And if you're repairing itself, then you don't need the other medications.
Right.
So, that was kind of where my last, I would say, 2 or 3 years of family practice started to lead. And that's when I started doing more and more research about hormone replacement therapy and
Yeah.
weight loss and, supplements and diets and, just kind of like taking a step back and saying, there's more to the picture than just this. There has to be more to it, and, that's when I went and I got my certification, my board certification, anti-aging, peptide certification,
Yeah.
my IV nutrition. So that really kind of transformed the way that I practiced medicine.
Yeah.
And not everybody was on board with that.
Like who?
Just people in the industry.
People you might have worked with, worked for.
Yeah, it was one of those things where, pharmaceutical companies come in and they're trying to educate you on the newest and latest and greatest medication, and
Yeah.
they're giving you the studies behind it, and that's your education. Like, there is no time to research on your own.
Yeah.
So you're just going off of what the pharmaceutical company tells you, which that's not practicing good medicine for me.
Yeah.
I don't believe in that.
I once heard, and I could be wrong on this, I once heard that the number one source of new information, the number one source that doctors learn new info from is from pharma reps.
Correct.
Is that true?
That's 100% true.
Wow.
Yeah. That's a first point of contact.
Yeah.
You know, they'll come in, hey, we have this new medication. I want to set up a lunch so I can educate you on it.
Right.
That's how we're getting our information.
Right.
Now, if we have time and we're that provider that goes above and beyond the call of duty, then we're going to do our own research on that drug.
Yeah.
You know?
Look at the side effects.
Right, of course.
Yeah.
But if we're too busy living our own lives and doing, you know, all the
Treating 50 patients
exactly,
a day.
and charting on them and doing everything that the insurance company tells us to do,
Yeah.
then we don't really have time to
Yeah.
look up all these new medications.
Right.
You know?
Yeah.
So I remember us having these meetings
Yeah.
once a week.
With the
And,
pharma reps.
With the farm reps,
Mhm.
and then after the farm reps.
Mhm.
And it was something where all of us providers would come together in the office and just kind of go over, recap.
Yeah.
What are the new medications out there? And, you know, what do the studies say? And what should we be doing as a practice?
Yeah.
And I remember just sitting in there and talking about these medications, and I was the only one who was kind of sitting back like, well, why don't we just help the patients lose weight and exercise
Right.
and get their lives back on track?
Yeah.
I'm not following,
Right.
you know?
Right. Because it's sort of like, from what it sounds like, is these pills are trying to cover up the effects of a certain cause.
Right.
So, like, if you're incredibly overweight, that's the cause, and the effects are
Joint pain, enlarged heart, high blood pressure,
Which
peripheral
is-
vascular disease.
right. And these medications target those things rather than the provider trying to get rid of the root cause, which would then get rid of these effects. Right.
Correct.
Okay.
Yeah.
And no
And
one.
it's tough, and I get it, you
Yeah.
know, because the patients that you're seeing, they have to want help.
Right.
Right?
You have to, because you know, if you've been eating the same diet and you're very stressed out, and you know you have kids and you have no time, it can be hard to make that shift and say, okay, I got to work out 5 days a week. I need to start eating veggies. What you're saying is they have to really want to be healthy
Yes.
in order to be healthy.
But I also find that they have to be educated.
Yeah.
You have to teach them why it's important.
Right.
You know, as a matter of fact, just so you're understanding this, when we see patients here for shockwave therapy,
Yeah.
we're in the room with them for about 20 to 30 minutes, just depending on the type of treatment we're doing.
Yeah.
That's a lot of time for us to kind of go through what medications they're on,
Yeah.
what disease processes they have, you know, why it's important to control this, why it's important to eat and exercise. And so we're really educating these patients while we're in the room treating them.
Yeah.
And I'm always astonished that these patients don't understand long-term effect of diabetes.
Yeah.
You know, and when you just explain it to them on why this happens
Yeah.
and what can happen in the long run, it all makes sense to them.
Yeah.
And then, like, the light bulb goes off,
Yeah.
and they're like, great, what do I do now? Like,
Yeah.
what are my next steps? So I just feel like if you just gave people knowledge,
Yeah.
then they're gonna want the rest of the information.
Yeah.
You know, they're gonna want the help.
Right.
But if you just tell them, like, hey, you're overweight, your BMI is this, and you need to lose weight, like,
Yeah. It's not gonna.
it's not the same thing.
Yeah.
You know, they need to know why.
Hmm.
People want to know why.
Right.
So you got to give them the why.
Right.
You know?
I guess my next question is focusing on the why. I know that you specialize in hormone optimization therapy,
Correct.
and by the way, that's the name of our show today: the hot hormone optimization therapy. I guess my question is, if you're targeting the why, you want people to know the why. What made you specialize in hormones? Of all the things to specialize in, why hormones?
Because once you get your hormones optimized, you actually control disease processes.
Really?
Yes. So once hormones are optimized, you have a tighter control of blood pressure, tighter control of cholesterol, tighter control of diabetes.
Yeah.
And I've seen it happen here in the office.
Right.
You know, I've had patients who, you know, have been uncontrolled diabetics, hypertensive, and once we get them optimized with their hormones, they feel better.
Yeah.
They're sleeping, they're exercising, they're eating right, they're having lots of sex, which is very important.
Mm-hmm.
Very important. And then all these things kind of come together and their body starts to heal.
Yeah.
You know, and they want to live. They want to live a better, healthier life.
Yeah.
And that's what it's all about. It's like, how do you empower these people
Right.
to make them feel better?
Right.
Yeah.
So it sounds like if you balance your hormones, if you optimize your hormones, that could potentially solve a lot of problems
Of course.
that people have.
Absolutely. If you really think about it, this is something I talk about in the consultation,
Yeah.
is, you know, it's all about evolution. So think about it this way, because we were actually dying
Yeah.
at that age.
Right.
So that was like our death. Then you can go the next 20, 30 years, right, without living in a dead body.
Right.
You can actually go do things.
How does one get their body to be like it was in their 20s, 30s, and 40s?
Hormone optimization.
Is that the number one?
That's the number one. That is the number one. Think about it. When you're 20 and 30,
Yeah.
right, you're at your highest peak.
Yeah.
You know, mental clarity, mental focus. You know, you're climbing the ladder.
Yeah.
You're able to work out. Your joints don't hurt. You
Yeah.
don't have muscle aches and pains. You're sleeping. You're having sex.
Yeah.
You know, you're not depressed. So when you kind of turn this age, if you think about it,
Yeah.
50s and 60s, that's when their joints wear down.
Yeah.
You know, they're not able to build muscle. They start getting osteoporosis.
Yeah.
They start, you know, getting dementia,
Right.
getting cardiac disease.
Yeah.
So all these things kind of start to happen when their hormones start to decline,
Right.
right?
Really. So it sounds like, I could be wrong, I could have misheard this, but the process of aging
Mm-hmm.
is actually your hormones becoming unbalanced.
Correct. So there was actually a saying that we learned
Yeah.
in our in the anti-aging world.
Yeah.
And the saying is this. Okay, so let me think about it for a second.
Yeah.
Because I want to say it correctly.
Yeah.
We age. The question is, do we age because our hormones decline,
Mm-hmm.
or do our hormones decline because we age?
Right.
Right?
Yeah.
But in all reality, it doesn't matter how you look at it, you still said hormones declining.
Right. They're
Right?
interlinked.
They're
right?
interlinked. So
Mhm.
you age and your hormones decline.
Yeah.
What came first
Doesn't matter.
doesn't really matter,
Right.
right?
If you can reverse aging
Right.
by balancing the hormones, right?
Exactly.
Okay. I guess that would leave me and I guess you guys to the next question is, well, how do I, if you really can optimize your hormones to reverse aging, why don't people live forever?
So that is the goal,
Mhm.
right?
Yeah.
And I feel like we were doing a pretty good job
Yeah.
at living a longer life.
Right.
But, you know, living longer and living a longer, healthy, happy life
Yeah.
are two totally different
Right.
things.
Not deteriorating,
Right.
on a bed somewhere.
Exactly.
Yeah.
Right? So, you know, are you in a walker and you've had multiple knee replacements
Yeah.
and, you know, you have dementia, you can't remember your grandchildren.
Yeah.
Right? So that's that aging.
Right.
Or are you the one that's aging that gets to, you know, go to Europe
Yeah.
and backpack and, you know, taking their kids to Disneyland or their grandkids to Disneyland
Right.
and living their lives,
Yeah.
right? And that's what it really comes down to, is how do you see yourself living your life,
Yeah.
right?
Right. So it's not so much length of time, it's the quality of your time. That's
Correct.
what you're saying. So with hormone optimization therapy, you could live your 60s, 70s, 80s, potentially 90s,
Yeah,
healthy and strong
Yeah.
if your hormones are optimized,
that's
right?
true. Absolutely. So, I mean, you know, at the end of the day, this is what I'll tell patients. This isn't up to me on what you do.
Mhm.
This is your life,
Yeah.
right? And I think that's the difference between going into family practice.
Yeah.
When you go in to go see your doctor is telling you what to do.
Yeah.
They give you a prescription, they tell you what to take, they tell you when to go get your lab drawn, they tell you when you're coming back.
Yeah.
Right? So you're not really involved in any of this process.
Right.
When you come see me, this isn't about what I want.
Yeah.
This is about what you want. You don't have to do anything I tell you.
Right.
I'm just giving you all the information and all the options. It just depends on how you want to live the rest of your life.
Yeah. So, if I'm 20 and I want to live like this, I'm in my prime right now, guys. I didn't know if you knew that, but if I want to stay in my prime forever, I would come to you and I would say that, and then
yeah.
what would
And I
you
would
do?
say, okay, Austin, based on your labs, this is what I would recommend for you.
Mm-hmm.
You don't have to do any of it.
Right.
You could do a little bit of it. You could do all of it. It just depends on what you want. What are your goals?
Right. And it doesn't matter what age you are.
No,
Okay.
absolutely.
Right. If someone's like, 30, 40, 50, 60, 70, 80.
No. I have a ton of patients that come to me in their late 20s, 30s, 40s. I mean, I feel for the most part, I want to say I probably see 50-50.
Yeah.
50% of my patients are menopausal, or the men that are in their 60s, 70s, 80s.
Yeah.
But the other 50% of them are not.
Yeah.
They're in their 20s, 30s, 40s. And they just want to age gracefully.
Yeah.
They want to feel better.
Right. They don't want to decline as they age.
Exactly. They
Right.
want to keep at the level that they're at right now.
Is it possible that even though I'm in my prime right now, or if someone else is in their prime, they can reach a new level?
You could, and it just really depends on what your goals are.
Yeah.
Again, it comes down to, specific things. And that's why in my consultation, I'm asking you specific questions, because I really want you to think about what you're looking to achieve.
Yeah.
What is it? Because everybody's goals are different. I'll have some guys come in and they'll say, I really just want to focus on building more muscle and having more strength. And then I'll have other guys come in and they'll say, I just need to get some sleep.
Yeah.
I really need a good night's sleep. And then I'll have some other guys come in and they're like, I just want to lose weight. So everybody's goals are just a little bit different.
Yeah.
And I really want to focus on helping them achieve that specific goal
Right.
instead of what my goal is for them.
Right.
Yeah.
Yeah.
That
makes sense. Awesome. Well, if someone's watching this or listening to this, if they wanted to get their hormones checked, if they felt like maybe they're not living the life that they think they deserve, what could be their next possible steps?
Well, they can give the office a call
Mm-hmm.
and speak to one of the specialists about setting up an appointment.
Yeah.
We get your labs checked. I'll order the labs, get the labs checked, and then you come in for your consultation. And that's when I sit down with you. I go through your medical history, I'll go through all your lab work, and then I'll give you a plan based on what I see.
Yeah.
And then, give you a little physical.
Yeah.
I'm always surprised at how many patients come in who've never had a physical.
Wow. Really?
Yes.
People have never.
They've never
That was
had
like
a physical.
required in school.
Yeah.
What if? Could someone call their doctor? Could they get this done through their doctor?
No, because insurance typically won't pay for this type of thing.
Yeah.
Because believe it or not, it's not a disease process in their eyes.
Yeah.
Aging is not really a disease process.
Right.
It's not hypertension, it's not diabetes, it's not high cholesterol.
Yeah.
So to them, what are we managing?
Yeah.
But every insurance is different, so I don't want to say that it's all insurance companies. I'm sometimes surprised that there are some insurance companies that will pay for this blood work
Yeah.
and for
Wow.
these patients to be seen. So
Awesome.
Yeah.
Wonderful. Okay, so they can call the Novus office. You guys can go to our website, thenovuscenter.com. The link will be in the description. Or what other options do they have?
or if this isn't what they're looking to do and they just want to continue on with family practice and the medications they're on, then I'll be this is your life.
Yeah.
Like, you can make your own choices. So make your own choices and make them an educated choice.
Right. Be educated, guys. Be educated. That's what this show is all about. The hot hormone optimization therapy. This is Stephanie Wolf, our lovely host, and myself included, Austin James Wolf. All right, guys. Thank you so much.
Thank you.
Thank you for telling me your story. I didn't know about half of that stuff, by the way, so I'll never be able to say that again, but thanks for listening, guys.